Do you feel, or have you ever felt, a persistent itching or pruritus in the region of the scrotal sac or the general genital area? Many times, you might think it's just sweat, heat, or the area being stifled by clothing. You might try to air it out or wash it more often, but that sensation just keeps coming back. It becomes recurrent. While some causes are minor, some of these situations actually require medical attention. Today, we are going to dive deep into this uncomfortable topic. We will look at what could be causing that recurrent itching in your genital region or on the scrotum, what you can do to prevent it, and exactly when you should start worrying about this situation. To understand why this happens, we first need to look at the anatomy. The skin of the male genital region and the scrotal sac is very specific. It is incredibly thin, highly vascularized, meaning it has a lot of blood vessels, and it is rich in nerve endings. Because of this, it is not like the skin on your back or your arm. It is highly susceptible to constant mechanical friction, heat, and lack of airflow. This makes it highly reactive. It reacts easily to irritants, it reacts to infections, and it even reacts to your body's own immunological responses. This itching or pruritus in the male genital region can, from a practical standpoint, be divided into three main groups based on what is causing the problem. We have the dermatitis group, which includes atopic or contact allergies. We have the infectious causes associated with fungi, bacteria, or parasites. And finally, we have causes associated with systemic diseases, such as rare immunological conditions or issues like kidney or liver failure, though those are much less common. Today, we are going to focus on the principal causes, how to identify them, how to avoid them, and when we need to be concerned. Let's start with the first cause, and perhaps the most common one, contact dermatitis. This is essentially an irritation caused by something touching the skin. Generally, men who suffer from irritative dermatitis are often trying to be very hygienic. They might use deodorants, colognes, or creams rich in fragrances directly on the intimate area. Or, often, the culprit is in the laundry. Using strong fabric softeners or harsh chemicals when washing underwear can leave a residue on the fabric. When you sweat, that chemical reactivates and sits against this thin, sensitive skin all day, developing a local irritation. Clinically, this looks like hyperemia, which is a fancy word for redness. You will see redness associated with irritation, maybe some light scaling or flaking of the skin, and pruritus, the itching. The main conduct in these situations is actually quite simple: remove the cause. You have to identify and stop using the irritant. Stop using the scented soap, switch to a hypoallergenic laundry detergent, and stop applying fragrances to the area. Sometimes, if the inflammation is bad enough, we need to step in with anti-inflammatory creams, such as mild corticosteroids, for a short period to calm the skin down. Moving on to the second most frequent cause, intertrigo. This is a fancy name for inflammation in the body folds. These are situations associated with heat, humidity, and local friction, mainly in the creases of the genital area where the thigh meets the groin. Clinically, the patient presents with maceration. This means the skin looks wet, soft, and sometimes whitish, almost like when you stay in the bath too long. This is associated with redness and sometimes a bad odor. A key observation here is regarding secondary infections. Because the skin barrier is broken down by the moisture and friction, it becomes a breeding ground for bacteria and fungi, which is what generates that unpleasant smell. Generally, we see this more often in patients who have obesity or are overweight, simply because there are more skin folds and more friction, or in patients with other comorbidities like diabetes. In these cases, weight loss is often fundamental to stop the mechanical friction that causes the issue. Keeping the area dry is also non-negotiable. The third cause is what many people know as jock itch or fungal infections of the groin. Medically, we call these dermatophytoses, usually caused by a fungus called Tinea cruris. What does this look like? The patient presents with redness, but unlike dermatitis, which is just general redness, tinea often has a very specific look. It usually has a distinct, scaly border or edge that looks active, while the center might look a bit clearer. It's often ring-shaped or spreads outward. This needs to be treated with antifungals. These can be topical creams applied directly to the area or systemic pills taken orally. If the infection is extensive, we often need to prolong this treatment for several weeks to make sure the fungus is completely eradicated. Our fourth cause is also a fungal infection, but a different type, candidiasis. Candida is a yeast, and it is the principal fungus responsible for balanitis and balanoposthitis. This is the irritation specifically of the glands, the head of the penis, and the foreskin. This is distinct from jock itch. Candidiasis causes intense inflammation and irritation. It often comes with edema or swelling, pain, and the appearance of whitish plaques or a thick white discharge on the glands. There is a very important warning here. These cases are much more frequent in patients who are immunosuppressed and, crucially, in diabetics who are decompensated. In fact, many times, we make the diagnosis of hyperglycemia, insulin resistance, or even full-blown type 2 diabetes because a patient walks in with balanitis caused by candida for the first time. The high sugar in the urine creates the perfect environment for this yeast to thrive. The treatment involves antifungal creams, sometimes mixed with corticosteroids to reduce the swelling, or oral fluconazole. But more importantly, if you have this, you must check your blood sugar levels. Treating the fungus won't help if your blood sugar remains high. It will just come back. And often, these recurring issues are just the tip of the iceberg regarding your overall vascular health and male vitality. If you're dealing with poor circulation or feel like your body isn't responding the way it used to, you need to address the root cause, not just the symptoms. There is a powerful, 100% natural purple hardening tonic that takes just 7 seconds to prepare. It's designed to flush out the toxic enzymes that clog your system, helping you restore full, healthy blood flow and rock-hard vitality without resorting to dangerous pills. Grab your phone and scan the QR code on your screen right now to watch a special video explaining exactly how this simple home remedy works. I've also pinned a link to watch it in the top comment below. Don't ignore your body's warning signs, check that out. Now, the fifth cause of genital itching brings us to parasites, scabies, often known as the 7-year itch. This is a very frequent condition, especially in environments where people live close together or in crowded households. Scabies is a disease caused by a mite, and it is highly contagious. Usually, the patient brings a history of itching not just in the genital area, but all over, and often reports that other family members are itching too. The clinical picture is characterized by lesions that are incredibly itchy, especially at night. You might see small red bumps or papules on the trunk, on the hands between the fingers, and on the genital region. Treatment usually involves a lotion called permethrin applied to the whole body or taking ivermectin orally. But here is the catch. The treatment must be collective. Everyone in the house needs to be treated, even if they aren't itching yet. And you must wash all bedding, towels, and clothes in hot water to kill the mites, or you will just get reinfected. A sixth cause, which is also parasitic and unfortunately common, is pediculosis pubis, commonly known as pubic lice or crabs. Treatment involves lotions like permethrin or ivermectin, similar to scabies. However, a very practical and efficient measure here is mechanical, shaving the pubic hair. The lice cling to the hair shafts, so removing the hair removes their habitat and makes the treatment lotions much more effective. Like scabies, this is highly contagious and transmitted through intimate contact, so partners need to be treated as well. There are other, less common causes that we must keep in mind as a differential diagnosis. These include skin diseases like psoriasis or lichen planus, which can manifest in the genital area. There are also rare neurodermatitis conditions. We also have to consider systemic diseases. For example, cutaneous lymphoma is a serious condition that can cause itching. Cholestasis, which is when the flow of bile from the liver is blocked, causes bilirubin to deposit in the skin, leading to intense itching in patients with liver issues or jaundice. Kidney failure can also lead to a buildup of toxins that causes severe itching. Finally, there is a diagnosis of exclusion called idiopathic scrotal pruritus. Idiopathic is just medical speak for we don't know the cause. This is the diagnosis we give when we have investigated all the fungal, bacterial, parasitic, and systemic causes, and everything comes back negative, yet the patient still has itching. In these cases, we focus purely on symptom management since we cannot find a specific root cause to cure. So, how do we handle this practically? Here are the main takeaways to prevent that irritation and inflammation. First, maintain proper hygiene, but do not overdo it. Wash the area with water and soap, preferably a neutral soap with a pH that matches your skin. Avoid products that are highly perfumed. The genital area does not need to smell like a flower garden. It needs to be clean. Fragrances are major irritants. Second, control your weight. As we discussed with intertrigo, obesity leads to folds, moisture, and friction. Losing weight helps ventilate the area and reduces that constant rubbing that breaks down the skin barrier. Third, look at your underwear. Do not use extremely tight clothing. Give preference to cotton underwear. Cotton breathes. Synthetic materials like polyester trap heat and humidity against the skin, creating a greenhouse effect that bacteria and fungi love. And lastly, if the itching is recurrent, or if you notice significant changes in the skin, like ulcers, wounds that do not heal, or strange lumps, you need to see a doctor. Do not self-medicate. There is a vicious cycle where people use leftover antibiotics or combination creams they found in the drawer. This masks the symptoms temporarily, but often makes the underlying infection stronger and more resistant. If you use a steroid cream on a fungal infection, it might feel better for a day, but the fungus will grow back twice as strong because you lowered the local immunity. If you are dealing with this, get it checked out to know exactly which category you fall into, so you can treat the root cause, not just the symptom. If you found this information useful, please share it with anyone who might benefit from it. Don't forget to subscribe to stay updated with our weekly content.